This is actually on the internet. This is all it takes is to type in a Google search of Roosevelt Hospital Danna Novak, and this will pop up within the first search.
Well, lots of other things are going to turn up too.
Oh,
say Daily
that's
News
true.
too.
But if you read
Daily
this,
News.
If you read this, we'll probably wrap it up at like 10 minutes.
Okay, so it's Monday, March 28, 2011. A Manhattan hospital refused to treat a homeless man who had taken a fatal drug overdose and then fired a nurse who tried to expose the mistake. Court papers charge. The suit filed by former Roosevelt Hospital nurse Danna Novak came as a shock to the family of the homeless patient, Daniel Iverson. In quotes, "We were called to the hospital and told he had died." Iverson's half-brother Robert Watford said of August 2009 death. Again in quotes, "No one mentioned that he had been in the hospital earlier and not gotten any care." Then it says, this is the part that's most relevant to today. It says, Iverson was well known to the emergency room staff at Roosevelt Hospital on West 59th Street. The 51-year-old alcoholic would wheel himself into the hospital, his prosthetic left leg lying across his lap, to complain about back pain or to persuade someone to let him sleep off his latest bender. Court papers say his last visit was different. When he came into the ER, he told Danna Novak, the triage nurse, he was sick of living and had consumed 700 milligrams of morphine, court papers say. She took his vitals, recorded a racing heart and low blood pressure, marked him emergent, in quotes, and rolled him into the resuscitation room. There, another nurse declared Iverson was faking it. The suit says. A second nurse berated Novak for being naive and said Iverson would have to wait. I'll jump forward a bit. There's no secrets here. This is all on the internet. But I'll get to the medical examiner's report. On August 23rd, autopsy by the city medical examiner determined Iverson died of an overdose of morphine and alcohol with sedatives in his system. So the reason I'm reading this is because this was in the Daily News in March 2011, and it discloses Daniel Iverson's frequent visits to the emergency room. It discloses information about his general condition, his appearance, the fact that he had a prosthetic leg, the fact that he suffered from back pain, alcoholism, and many other things. And this never came up as...
And the consumption of the morphine.
Oh, and of course, I beg your pardon. Most importantly, it details that he had taken a morphine overdose, that he was suicidal, and that he had come to the hospital seeking treatment and was denied treatment and consequently died, and a morphine overdose was found as the cause of his death by the medical examiner. All this information has been public domain since 2011, if not even early. Actually, I would say January 2010, because that's when, January 2011 is when the lawsuit was filed. And at that time, all of this information had been on the New York State Supreme Court website and fully accessible to anyone that chose to search for it.
Now, what I would like you to read is the latest email in which they complain, they say they want to talk to you about your YouTube videos.
Okay, the one I read to you today?
Yeah.
Give me 2 seconds and I'll pull it up. I was not ready for this. It's coming. Here it is. So this email was only sent to me on the 20th of February, which is 4 days ago. And it was sent to me from the Nurses Union, New York State Nursing Association. And this email, which now says Mount Sinai Hospital, because now Mount Sinai conglomerate owns St. Luke's Hospital, Roosevelt Hospital, the Ioneer Hospital, Beth Israel Hospital, and whatever else belonged to Continuum. They've bought out Continuum, and now we are talking about Mount Sinai Hospital.
And they're a national group. They
So-
own hospitals in California?
Yeah, California, Florida, I think everywhere.
Uh-huh.
They're big. So this is now Mount Sinai who are sending this email to my union representative, who forwarded this to me. The email says, the Mount Sinai Health System Audit and Compliance Services HIPAA Compliance Office was recently notified of potential HIPAA breaches. Specifically, we were made aware of videos posted on public YouTube account, and then it has the HTTP link exactly. These videos are of Miss Novak. At various times in the videos, Miss Novak discloses protected health information, PHI, regarding a Mount Sinai Roosevelt Hospital patient, and in particular discloses the patient's name and specific protected medical information about the patient, such as information about substance abuse and mental health issues. We would like to meet with Miss Novak to obtain more information about these videos and to allow her the opportunity to explain their contents and her actions before we undertake further investigation and make recommendations for corrective action. Yours truly, Heather Chamides.
Did she have a title?
There's no title.
And what's it say on top for her title? Does it say anything, or is she just speaking on behalf of the whole organization? That's that. Just nice and simple.
Oh, okay. At the top it says Heather Chamides, MSW,
Master of Social Work.
Director, HIPAA Compliance.
Oh, okay. So, if I were your lawyer and I would respond, you can say all the information that you disclose, except apparently for the couple of numbers, like you give the actual blood level as 70 in the 70s and below 95 is bad.
Yeah.
But other than that, everything else is already in the Daily News.
In the Daily News,
and several other
websites, and on the Supreme Court website.
Right.
And I actually do believe the levels are in the lawsuit.
Uh-huh. Good. So, if you explain that to them, what would they say back?
I would imagine that their intention is to, as they say, discipline me, and that could include anything, because I have a very long history with this Mount Sinai Hospital. Since I was a whistleblower in 2009, I was subsequently wrongfully terminated after a long stint of being harassed and bullied and threatened. I then fought an arbitration with the union, the New York State Nursing Association, which I won in August 2012. I was then reinstated immediately to my position with benefits, seniority, back pay, all of that. And since August 2012 until now, I've been under constant harassment, bullying, slander, threats against me to my person, wrongful and frivolous disciplinary action, threats to discipline me. I've not been paid my salary. I've had FMLA requests denied. I've been denied vacation. I've also not been paid my benefit times that I am owed. What else?
Well,
there's a lot.
Learned that there was an order not to talk with you.
Yep, I have that right here. Should I play it?
Just say what happened.
On a number of occasions, I've made contact with the hospital to try and. The most recent would be just a week or two ago.
You made a telephone call?
I made a few phone calls to the hospital after I was asked to attend a meeting regarding these YouTube videos, and I was sent a letter by UPS mail not asking but demanding that I appear on Friday at 3 p.m. at a meeting in the emergency room at Mount Sinai Hospital and to bring a union representative with me.
Now, at that point, they did not disclose that it was about the YouTube videos.
No.
So, as a result of some give and take, they finally did come through and give some details that it is about the YouTube videos.
Yes, after I pressed and pressed through the union, yes. But I will add that letter that demanded that I attend a meeting had no phone number, no email address, no fax number, and no way for me to respond to that letter. It was a letter that came without any opening for me to
just be
respond.
There or else.
Be there or else. Yeah.
And the implied or else. It was just plain be there.
Yes, be there. So that's when I called the hospital nursing office, and I spoke with Miss Bridget McNulty, who calls herself the systems director. She told me verbatim that she has been instructed by the hospital's labor relations department and the legal department not to talk to me, not to communicate with me, not to pass on any documents to me or anything. She made it clear to me that no one else would speak to me. I asked her if I could speak with the nursing supervisor, and she did not allow for that.
And she said that she also instructed other people now?
Then I told her I would call later and try to speak to someone else. She told me that would be very unfruitful, and when I asked her why, she said that as the systems director, she has instructed all of the staff working beneath her not to communicate with me and not to speak with me. And she told me that any phone calls I make would be unfruitful. I have a recording. I actually have all the recordings of these phone conversations. And should I play one? I don't know.
Well, another point I want to make is that there was a finding by your doctor and a doctor appointed by the hospital that concluded the work environment as a result of the retaliatory policies was so cruel that it would be unfair to ask you to subject yourself to so much abuse. Is that about right?
Yes.
And that it was even contrary to your mental health to experience the amount of abuse that the hospital was routinely subjecting you to.
That's exactly right. And in fact, since I have stopped going to work on doctor's instructions, it seems that the retaliation is only worse, even though I'm not there. It just seems like they are full artillery attacking me. Their law firm, Wilson Elser, are constantly attacking me through various legal tactics.
And it is, in terms of dollar and cents, we can estimate that they have blown nearly $1 million on legal fees just to pick on you.
Considering this has been going since the beginning of 2011, I would say 4 solid years. I would imagine it's at least $1 million. I also, I won't say.
Well, no, I remember you did hear that one of their
Yeah.
top managers,
Ricky Rower,
she did say how much she appreciates the billing as a result of
the money that I have generated for Wilson Elser. Yes, she did say that.
What was her language like?
Her language was, "We love Danna Novak here at Wilson Elser. She has generated more income, for more money or income, I don't know, for our firm than any other client these past years." And she was laughing and joyous when she said that.
And meanwhile, another part of the story that I think is important is, as a result of your informing your supervisor and all the other pressure that you helped bring to bear, that they did definitely change their policies in many ways to step by step prevent another event like happened to Daniel Iverson, although this was ordered by the government?
That's correct. When the Department of Health went to investigate the death of Daniel Iverson, and I reported this to them back in 2010, I guess, and they conducted a long investigation which took many months. They then called me and told me, and I have emails as well, they told me that they have substantiated my story completely and that they are going to refer their investigation up to CMS, which is the federal government. And they did that, and then CMS conducted a thorough investigation, and they substantiated the investigation findings of the Department of Health. And CMS then placed Mount Sinai Roosevelt Hospital on a termination track for all federal funding. They were given a 20-day time period in which they had to create a plan of action to correct what they refer to as deficiencies. Deficiencies in their language is things that were done wrongly by the hospital that created malpractice. Like a deficiency in this instance, Daniel Iverson did not receive oxygen. Daniel Iverson did not receive Narcan. Daniel Iverson did not have a psychiatry assessment. Daniel Iverson did not have a medical assessment or a nursing assessment. All these things were listed as deficiencies, and there was a long list. I have this entire document. The hospital in those first 20 days had to get together and provide a plan of action where they would prevent these kind of incidents from happening in the future. They actually presented their first plan of action and it was denied by CMS. and they were given an extra 10 days to provide a plan of action. That second time round it was accepted. And so the hospital was forced to create and change policies that to prevent this kind of thing from happening in the future. So new policies were created.